Different areas of head trauma cause different problems. For example, trauma to the temporal region is the most dangerous because it can cause bleeding inside the brain. Trauma to the back of the head can cause blindness. Trauma to the forehead most commonly causes just bumps. Trauma to the upper part of the head can cause a condition where a person ignores the left side of the world. That is why we will talk about head trauma, how to spot red flags, and how to treat it. Forehead trauma is one of the most common types. This part of the head is called the frontal region and is one of the most durable parts of the skull. If we compare the strength of bones in the human body, the frontal region scores 9 or less. Only the femoral bone is stronger. Most forehead injuries cause a bump, which is the result of bleeding under the skin and swelling of soft tissues. The pain is usually local and mild and goes away shortly after the injury. If trauma is more severe, it may cause a concussion, which is a mild traumatic brain injury. This happens because the brain moves inside the skull during the trauma. The physical stretching of brain cells causes communication disruptions between neurons. There can also be temporary chemical imbalances and, in more severe cases, inflammation and bleeding inside the brain. How can we tell if a concussion has occurred? A concussion has 3 stages, from mild to severe. If the person has headache and dizziness but no loss of consciousness, it's usually a mild concussion. In this case, the prognosis is very good. The person will recover fully in a few days. Rest is the main treatment. Avoid screens like TVs and computers as they worsen symptoms. This is because screens overstimulate the brain, which interferes with recovery since the brain's chemical balance is already disrupted. If the person experiences loss of consciousness for less than 1 minute, it is considered a moderate concussion. Better prognosis is still favorable, but close monitoring is required. Watch for signs like vomiting or drowsiness, as they can indicate brain swelling. Physical and mental exertion should be avoided. In some cases, a CT scan may be needed for further evaluation. In cases of severe concussion, the symptoms include loss of consciousness for more than 1 minute, severe confusion, and persistent vomiting or seizures. Worsening neurological symptoms such as slurred speech and unequal pupils are warning signs of severe trauma. If left untreated, severe concussions can lead to long-term cognitive problems such as memory loss. Severe concussions require immediate brain imaging to check for bleeding. Recovery is slower and often requires hospital observation during the initial stages. Fortunately, everyday traumas, such as minor falls or bumping into furniture, rarely cause serious concussions. In most cases, only local pain and swelling occur. In these minor cases, use ice compresses for 15 to 20 minutes every hour during the first 24 hours if needed. For pain relief, paracetamol or ibuprofen can be used. Rest and observation are also important to make sure no new symptoms develop. In moderate cases, sometimes lacerations happen, which means a tear in the skin or tissue. That is different from a simple abrasion because it involves deeper tissues and can sometimes reach the muscles, nerves, and blood vessels. If skin lacerations occur, they require surgical closure. When the skin is damaged more than 1 centimeter, surgical stitches called sutures are needed because the wound will not stay closed on its own. Now let us talk about temporal region trauma of the head. It is the weakest point of the head, especially the temple, which is the area on the side of the head above the ear. This area is called the pterion, where 4 skull bones meet. If the forehead scores 9 out of 10 in strength, the temple strength is only 4 out of 10. The pterion lies over the middle meningeal artery, and during trauma, broken bones can rupture this artery, causing an epidural hematoma. An epidural hematoma means bleeding between the skull and dura mater, the outermost protective layer of the brain. If left untreated, this bleeding creates pressure on the brain and can eventually cause irreversible brain damage and death. When the middle meningeal artery is damaged, symptoms worsen quickly, sometimes within minutes. However, the first symptoms may be mild headache, dizziness, confusion, nausea, and vomiting. Over time, symptoms worsen. The person may experience blurry vision, dilated pupils on the side of the injury, difficulty speaking, and seizures. That weakness or paralysis often occurs on the side opposite the injury. In some cases, fluid leakage from the ears indicates a cerebrospinal fluid leak, which suggests a skull base fracture. If left untreated, the person may experience loss of consciousness, coma, and eventually death. If you wonder whether temporal bone damage is visible from the outside, it usually is not visible. Here is a typical scenario. After trauma, the person may lose consciousness. After a few minutes, they wake up and feel better. This temporary recovery is called a lucid interval. But after some time, the person's condition worsens and symptoms deteriorate rapidly. The golden window for surgery is 1 to 2 hours after symptoms begin. After 4 hours, even with treatment, some symptoms may persist due to irreversible brain damage. This classic scenario of a lucid interval followed by rapid symptom deterioration is a hallmark of epidural hematoma, although it occurs in only 30% of cases. When the parietal region is injured, sensory disturbances such as tingling, numbness, or changes in spatial awareness are common. Mild concussions in the parietal region often cause headaches, dizziness, and confusion. Some parietal injuries can increase the risk of seizures or post-traumatic epilepsy. If the trauma is severe and intracranial bleeding is suspected, a CT scan is performed to monitor the condition. The prognosis for parietal trauma is good if the injury is not very severe. Even mild fractures in this region typically heal within 6 to 8 weeks. An interesting fact about parietal trauma is that it can lead to neglect syndrome if the right parietal region is damaged. This condition means the patient ignores the left side of their body or environment. For example, the person might not shave the left side of their face or might eat food only from the right side of the plate. Neglect syndrome usually affects the side opposite to the damaged brain region. This happens because the right parietal lobe controls spatial awareness on both sides of the body. In contrast, the left parietal lobe is responsible only for the right side. When the right lobe is damaged, the person loses spatial awareness on the left side. Neglect syndrome may improve over time with rehabilitation, such as occupational therapy and visual-spatial exercises. However, recovery can be slow, and some deficits may persist depending on the severity of the brain injury.